How do doctors differentiate between bone tumors and arthritis? When it comes to bone pain, many people wonder how doctors can tell if it is due to a bone tumor or arthritis. Both conditions can cause discomfort, but they have unique signs that help in diagnosis. Doctors relying on a combination of clinical evaluation, imaging studies, laboratory tests, and sometimes biopsy to make this distinction. First, during a clinical evaluation, doctors look for specific symptoms. Bone tumors often present with localized pain that may worsen at night. This pain is not usually related to joint movement and may be accompanied by swelling or a noticeable mass. In contrast, arthritis tends to cause joint pain, stiffness, and swelling. This pain often worsens with activity or in the morning and tends to improve with movement. The inflammation in arthritis primarily affects the joints rather than the bones themselves. Next, imaging studies play a crucial role. X-rays are typically the first imaging tool used. Bone tumors may show up as abnormal growths or areas where the bone is destroyed. On the other hand, arthritis can be identified by changes in joint space, bone erosions near the joints, and sometimes bone spurs. Magnetic resonance imaging, or MRI, is more sensitive and can detect early involvement of the bone marrow in tumors and soft tissue extension. It also helps identify inflammation and cartilage damage in arthritis. If X-rays are inconclusive, MRI can be particularly useful for spotting subtle bone abnormalities or distinguishing infections from tumors. Laboratory tests further aid in the diagnosis. Blood tests can help identify different types of arthritis and rule out infections or malignancies. Markers like C-reactive protein and erythrocyte sedimentation rate indicate inflammation, which is common in arthritis but can also be elevated in cancer. Specific antibodies, such as rheumatoid factor and anticyclic citrullinated peptide antibodies, support the diagnosis of rheumatoid arthritis. If a bone tumor is suspected, a biopsy may be necessary to confirm malignancy through microscopic examination. In summary, doctors take a systematic approach to differentiate between bone tumors and arthritis. Bone tumors typically cause localized pain and destructive lesions on imaging, while arthritis affects joints with inflammation and changes in joint space. A definitive diagnosis of bone tumors often requires a biopsy. This differentiation is critical, as the treatment and prognosis for each condition can vary significantly. If you are experiencing persistent bone or joint pain, it is essential to consult a healthcare professional for a thorough evaluation and timely diagnosis.